Good afternoon, Chair Nose, Vice Chair Nelson. For the record, my name is Lisa Reynolds. I'm State Representative for Oregon House District 34, and I'm very grateful to be here before you today to talk about House Bill 3320, a bill that aims to ensure that low-income and uninsured Oregonians can get the medical attention they seek without receiving illegitimate bills and without being threatened by collections agents. As you all well know by now, I'm a pediatrician, and as a medical professional, it's my life's work to serve and advocate for the health of all Oregonians, especially those who face significant barriers to health care. And as you've also heard me say before, poverty is a vicious cycle that causes toxic stress. It impairs both physical and mental health, and especially for families with young children, it can disrupt early relational health. And it's why I often talk about ending child poverty. And when it comes to medical care, I believe in making sure that patients and families can access care without having to go bankrupt. I'm very, very proud to practice pediatrics in a state that covers all kids with the Oregon Health Plan. And as noted in a Kaiser Health News article carried by the Oregonian just last week, Oregon will become the first state in the nation that will continuously cover all kids from birth to 6 years old. Other states are scrambling to follow suit. And Oregon is one of 30 states that has opted to cover women for the full year postpartum with health care coverage. We are the envy of my pediatric colleagues from other states, and I am the envy of my Oregon physician friends who take care of adults. It's important to note that Oregon is taking great strides to cover more adults with health insurance, but we are not there yet. So what do we do with these Oregonians already struggling to meet their basic needs, who are low income or uninsured and need medical attention? Enter Oregon's nonprofit hospitals, who have a legal and I would say moral responsibility to care for this vulnerable population. Nonprofit hospitals. It means that hospital earnings cannot benefit shareholders or individuals. These hospitals do not pay any federal, state, or local taxes. And the value of that status nationwide is $28 billion. In exchange for these tax exemptions, the hospitals are required to provide charity care and other benefits to their community. House Bill 3076, which was passed in 2019, required that Oregon's nonprofit hospitals screen patients' eligibility for charity care, which is the term we use for free or discounted health services for patients who cannot afford to pay their medical bills. The intent behind this bill was to prevent medical debt for Oregon's most vulnerable and to enliven the charitable missions of nonprofit hospitals. So I was shocked. I actually gasped out loud after the New York Times reported in September about Providence Health System's aggressive tactics to collect payments from people who qualified for charity care. The Washington State Attorney General, Bob Ferguson, has filed a consumer protection lawsuit alleging that Providence wrongly claimed these patients owned a total of more than $73 million. Our Attorney General, Ellen Rosenblum, has launched an investigation into Providence. Other reports, including some that will be discussed by panelists today, shine a light on how we need stronger compliance with state law. Many of our hospitals are sending vulnerable people into a cycle of debt and stress when they should be offering assistance. We find that charity care has not been adequately implemented throughout Oregon, even though we passed House Bill 3076. And in fact, only one out of Oregon's 60 nonprofit hospitals has fully provided full, fair, and consistent charity care to their patients. The result? Low-income patients meant to be covered are sent to debt collectors and sued in small claims court for bills they were never supposed to pay in the first place. Of course, these folks do not have the means to hire lawyers or to defend them throughout this process, and we know that medical debt is the most common reason for bankruptcy filings, making these families more vulnerable in terms of housing security and so much more. Some of the consumers during this hearing will share their stories of being buried in expenses that make them unlikely to pursue the care that they need. It's past time, right? All nonprofit hospitals need to abide by the charity care standards to uphold their obligations to patients and to our communities. This bill has been worked on with SEIU, with the Oregon Association of Hospitals and Health Systems, with OHSU and Providence Health Systems, and I thank them all for their good faith efforts to right these wrongs. Providence is in support of this bill, and the Oregon Association of Hospitals and Health Systems supports the amendment currently in progress, and we will talk about that a little more. But at the core, what this bill does is it ensures that eligible patients get access to financial assistance through widespread screening for eligibility for this assistance before bills are sent out, right? I don't know. I was sharing, I got a bill from my dentist the other day and I got nervous. It was for like $8. But I mean, it's hard to get these bills in the mail and worried about what they enclose. And it's also not very clear what are truly the patient's responsibilities. Financial assistance programs need to be easily accessible online, and if and the appeals process must also be very clear. And if a patient does pay for services that should have been covered by law under financial assistance, they need to be refunded that amount plus other costs associated with it. So I'm going to have the experts speak after me, but just, we all live, in healthcare, we live by the code, first do no harm. And that includes how we treat the patients that receive bills for our services. In many cases, what Oregonians have experienced is the exact opposite. And I hope you'll join me in supporting House Bill 3320. Thank you so much for your time.